Well, pollution is creating a menace in the national capital. With the rise in the air quality, the people are facing major problems, and the hospitals are also seeing a surge in people having problems. The people are facing many problems such as breathing issues. The pregnant women are facing major issues. Not only that, people with asthma are also facing major of these issues. The advisories have been given by the experts of the fact that people should not go out until unless it is very necessary. One should wear masks itself. Now, to talk more about it, we are joined by a very special guest. We are joined by Praveen Kumar Reddy, who is the director of Swami Vivekanand Health Care Center, Jhandewalan, Bag, and we will be talking to him, and we will be getting a perspective of what can be done, what are the do's and the don'ts itself. So now welcome to NewsX. But my very first question to you would be: we are seeing a high in pollution, problems are facing. As a doctor yourself, as a leader of yourself, you are handling 14 such hospitals in around the country. What kind of surge are you seeing of the patients in terms of the breathing problems or pregnant women who are facing such problem because of the high in pollution, especially in the national capital?
Very good morning to you. As you rightly said, the pollution has a definite effect on health of people, and we are seeing a surge in the respiratory illnesses in the hospital. OPDs are in rise, especially the breathing problems, and people who has existing issues of asthma, their exacerbations and all. So, the pollution has increased their vulnerability towards existing diseases. And especially the pregnant women, yes, they are absolutely prone for, such kind of allergies, breathing problems. And as you know, the pregnant women, it is having a definite effect on the offspring, the child. So the air quality should be good, and pregnant women are exposed to pollutants, and lungs are the medium where the oxygenated blood is carried towards the fetus. So intrauterine growth retardation and other pollutant related allergies are very high, will be very high in the fetuses. So until it is warranted, very emergency, they should not be exposed to pollutants, especially the bad air in the national capital, and they should be taken adequate precautions like using mask, and in-house also it is recommended to use some barriers like nowadays the air purifiers, something like that.
And Dr. Praveen, my another question would be: what are the do's and don'ts one should be following? What can be, because since we are also staying in a high polluted area, even though yes, the government are ramping their efforts to ensure that the situation is better, but still the air quality is very high. What do you, as a doctor yourself, would want to suggest our viewers who are watching you on television right now about the do's and don'ts?
Yes, precautionally, yes, one should be very cautious about the pollution. One should not do pollution, first of all. If we talk about not polluting the air, so one should be using the better quality of vehicles and other things and all. So yes, for health perspective per se, precautionary things, one should use mask. So since we cannot avoid going out, for the those who are working, they cannot avoid going out, so they should be very cautious and they should be using mask. General barrier mask is okay, but N95 is more adequate, appropriate to use, and especially pregnant women, they should be very cautious and they should be using this. And
also my very last question to you would be: what about eye irritation? If suppose when we go out, when especially two-wheelers go out, we have this eye irritation because of the high in pollution, high in PM 2.5. What can they do? What kind of help would you also offer as a doctor to them?
Yes, you rightly said, pollution can cause irritation of the eyes, watering, conjunctivitis, all these problems. So one should use barriers like goggles and spectacles, and frequent regular face wash and eye wash can be recommended. In case they have any issues, if in case they develop any such issues, they should consult doctors, eye specialist, or any doctor for the medication. Some lubricant drops can be used, and helmet and other barriers will definitely help for the two-wheelers.
Thank you so much, Dr. Dr. Praveen for speaking to us. So yes, viewers, he spoke about many such do's and don'ts that one should follow, and he has also given an advisory that one should be wearing mask at this point of time, and unless it is very important, one should not go out because of the rise in pollution, because of the rise in PM 2.5, which is causing a lot of problems to people who are facing breathing problems, pregnant women, people who are two-wheelers because they are facing that eye irritation itself. So yes, this is what we had our conversation with. For NewsX, this is me, Brian Thomas, signing out. Camera person Bradon for NewsX, Delhi.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.